Hello and welcome to Your Health DeKoded. Today we turn our focus to the recent uptick in COVID-19 cases across India. As of today, India has over 1,000 cases. So how worried should we be? What should we be doing? To answer these questions and many more similar questions or questions that you and I have every day because of COVID-19 cases, I have with me Professor Dr. Sanjeev Bagai. He's a Padma Shri awardee. He's the chairman of Nephron Clinics. I also have with me Dr. Rajeev Jayadevan, who's the co-chairman of the National IMA COVID Task Force. Dr. Rajeev, if I can start with you. Firstly, thank you so much for joining us today. You're in Kerala, and Kerala has the highest number of COVID-19 cases. I think Kerala has more than 400 cases. What's the situation there? What can you tell us?
One of the reasons why Kerala's numbers are generally higher is because there is access to testing and there's a system of efficient reporting. So clearly, not just with COVID, we report things like Nipah and so many other conditions. So the numbers do not necessarily mean that the true numbers are higher in this part of the world. So what we're seeing on the ground is clearly there are cases of COVID-19, and the way we say it as doctors is that there are many people who come with fever every day to the clinic, and among all the people with fever that come in a particular day, yes, COVID-19 also has a place in it. It's not like all the people who come to see doctors are suffering from COVID. For instance, that was the situation in the first half of the pandemic when there was a massive surge of patients. We're not seeing that at all. In fact, we are seeing influenza. There are 3 influenza viruses that are circulating right now, influenza B, and then the other 2, H3N2 and H1N1. And they are in fact causing more disease than COVID is at this time. The severity, you would want to know, most people are not requiring hospitalization, which means that they can be easily treated as an outpatient, if you will, which means that they can be sent home with regular medications. There's no need for antibiotics, and most people recover by day 3 or day 4. Now, in any society, there are individuals who are of frail health, either due to their comorbidity or by age or both. Now, in these individuals, COVID is often seen as a bystander when a bad event occurs. Yes, they are also found to be COVID positive. So you will see some deaths being listed as being COVID positive. That does not necessarily mean that COVID killed these individuals, but it's simply that they also had COVID going on in their system. We're also seeing people with no symptoms and are found to be COVID positive simply because they got tested as a bystander.
So the 2 deaths that are being reported out of Kerala as COVID deaths, firstly, if you could tell our viewers if that is true. Also, from what I do understand, you're saying is that they weren't necessarily COVID deaths, but because of many other comorbidities, COVID was also a factor.
Yes, if you take the total number of deaths that happen in Kerala, it's very easy to find out. You look at the total death rate and divide by the number of days in a year, so it'll translate to 685 deaths on average every day. That's the number of people who die in the state of a population of 3.3 crore. Now, among these, there will be people who die of many conditions, predominantly frailty, old age, some sort of a respiratory infection, stroke, heart attack, and so on. So the so-called COVID deaths, I don't have their records with me as I speak. But typically, not just in Kerala, but elsewhere as well, most of these are people who were ill at their baseline, and COVID perhaps did not have a direct role in their death. But I'm yet to have access to all the records to see if a true COVID pneumonia actually occurred. We will remember from 2020 and 21 when even very young and robust people were coming in with a severe pneumonia and dying in front of our eyes. Now, that sort of situation is not happening anymore, thanks to widespread population immunity, partly from India's excellent vaccination drive and vaccination acceptance, and also from multiple bouts of COVID infection that have occurred over the years, especially since the arrival of a variant called Omicron. 2 years into the pandemic, in the last week of November 2021, arrived this Omicron variant, starting apparently in South Africa, but reached India in about a month and a half. and it practically infected almost everyone in the planet. And that will not be an exaggerated statement to make. So that gave the entire world a baseline immune response, and which protects the internal organs against severe damage should there be an infection. But such an immunity is not strong enough to stop the infection from happening again. And over time, our immunity levels do drop, which is normal, by the way. It's a healthy body situation to have your antibody levels drop, because you don't need antibodies to be made around the year if the infection is not there. So when the antibody levels naturally drop, when new variants emerge, yes, they get a chance to reinfect the individual, but they don't cause the deaths and the carnage that they did in the past because of the factors I mentioned.
Right. Dr. Sanjeev, if I could come to you, firstly, if you could tell all our viewers, what is India's situation compared to the world? Because we did hear of a lot of cases in Singapore, Hong Kong. How are we placed compared to what's happening globally?
Good day to everyone. So I think India has been placed in a very good position. The Indian healthcare system is extremely well geared up. Even before COVID and now post-COVID, all the shortfalls have been very well taken care of. At least in Delhi NCR, we have not seen a sudden surge of Omicron. And having said that, with your permission, just in 60 seconds, let me describe what kind of variations we are seeing in the Indian diaspora. So Omicron has almost 1750, now going up a little more than that, number of sublineages. So it's continuously evolving. As it's evolving, it's not getting more lethal. And the reason is what we are seeing in India is basically three different sublineages. One is JN.1, the other one is called as LF7.9, and the third is called as LP8.1.1. These are all breakaways of the original BA 2.86, which became JN.1. So that's your parent strain, and then it subdivides further on. During its evolution, it has become more transmissible. So from person to person contact, it can go a little quicker. But the lethality, that means it's binding onto the ACE receptors in the body, has gone down. So that's a good trade-off what we've got in these three lineages. And more importantly, it's the fittest in terms of immune evasion. So your past immunity may not hold you that well now. We are not going to see the kind of carnage we saw in terms of fatality. This is not going to cause hypoxia and lung damage and pneumonias. This is not going to cause an upsurge of ICU admissions and ventilators and antivirals. In any case, antibiotics are of no use. The most important advice is mask, social distancing, especially during the upcoming holiday season. This is going to infect, but it is not going to cause death. It is going to be a very mild subclinical infection, mild cold cough fever, 3 to 5 days. The best thing is mask, and with that is isolation. Going forward, a lot of people have asked me at least, what about the vaccines? As and when you come to that, we'll discuss that.
Right. So I was actually going to come to that. So, but before that, I have, from what you've said, one is that what was perceived to be COVID-19, this version is like a viral. There is no need to worry. It's going to be there, cold cough, all of that, 3-4 days, possibly a week, gets over, no need for huge hospitalizations or anything. Number two, what you said was very interesting is this period, right now in India, there are summer holidays, people start to travel, you know, families sort of are going together, a lot of hill stations, etc., or tourist destinations will be very crowded. Globally as well, July to September is when everybody around the world seems to travel. So apart from a mask, which absolutely common sense, we should all, is there anything else? Because, you know, when crowds do get together in these popular destinations, what should people do?
Yeah, so three important points here as a carry-home message for the audience. Well-fitting N95 mask. This is a viral infection. It's an airborne infection. It can travel well beyond 6 feet, even up to 60 feet. It can jump from room to room. It's very much like the original COVID in terms of its spread. Please wear a well-fitting N95 mask, especially in crowded areas, airports, and in the aeroplane during the flight. Keep good social distancing, hand hygiene, personal nutrition. People who are hypertensive, diabetes, asthmatic, COPD, they need to specially look after the health, because if you have brittle diabetes or labile hypertension, you can be more at risk. Getting COVID is never a good idea. So very often people misconceive and feel that it's not that lethal, so does not matter. There is a concept of long COVID. It's been well researched, well documented, well literatured, that almost 15 to 20% of even subclinical or asymptomatic carriers of any strain can give you long COVID. And that's another chapter altogether. So it's best to avoid it. Look after your pre-existing health conditions. At the present moment, there is no need of revaccination or any boosters. There is a level of herd immunity which is developed in India because of a phenomenal vaccine drive. Having said that, those original vaccines which were made against the wild strain are not useful for this strain. So to have Covishield and Covaxin now into the Indian market will be futile. There is bivalent vaccines available abroad and Novavax and things like that, which are more strain specific, sublineage specific. But we've not reached that stage, so there is no need of any boosters, no need of any revaccination. The previous immunity which we had because of subclinical infections or because of vaccine induced will wane over a period of time. That's a normal consequence. It's a law of nature. But this particular strains, what we are seeing as GN.1 and the two breakaways of it, are very immune evasive. That means they are called the fittest subvariant strains. So we have to be careful to avoid the infection, because you're liable to get the infection because your body immune system is not going to prevent it as much as before. So just simple precautions. Don't take alternative medicines, don't take antibiotics, don't take combination painkillers, fever medicine. Simple paracetamol should hold good. Consult your doctor. All patients with fevers are not COVID strain. And all virals are not COVID either. So we see at least 10 or 12 different type of upper respiratory infections, and all through the year. We see bacterial infections, and all the patients coming with fever need not get recurrently tested. So that fear in the mind should not be there. The only differentiating factor between this particular strain of GN.1 and NB 1.8.1 is extreme fatigue. So if you are experiencing certain classical clinical features, consult a doctor and he or she will be in the best position to guide you whether you need the test or not. But masking, social distancing, home isolation are the three best way forward. Special care during the holiday season and travel. Over to you.
Right. So, Dr. Rajeev, from what Dr. Sanjeev said, I just wanted to understand two things. One is that anyone who is suffering from long COVID, do they need to be extra careful that if they get this strain of COVID, it's going to make things worse? That's number one. And number two, if not now, another 2 years, 3 years, what is it that medical experts project that if this continues, is there a time that we will all need to get vaccinated again? Or, now it's just another viral and we're just going to live with it?
The problem that COVID created in the beginning was because the entire humanity, mankind, had no memory of having encountered such a virus. So it was a very rare event in the history of mankind that is a virus that has never been seen before has suddenly descended with which can spread at such rapid speed, can cover the globe in 6 weeks. Now, vaccination, as we both discussed, has really eliminated that gap. And people who have not been vaccinated, who are alive today, have obviously survived their infections. And there are many who did not. There were people who were not vaccinated who did not survive. And there were people who were vaccinated who also were so ill who died as well. So let's look at the people who are alive now. They have substantial immune memory against the baseline structure of this virus. It's like having a large car with minor modifications being made on the outside, but the car remains the same. So the underlying organs, our internal organs are well protected by this baseline immune response, but it is the infection part. Our immune system has two arms. You know, the stuff that stops the infection and the stuff that stops you from dying. Now, the stuff that stops you from infection is not very effective, and that's a rule with this family of viruses, not just with COVID. In fact, we knew that even before the vaccines were made, that they're not going to protect us long term. That is a very well established fact. We had written about that back in 2020. Now, I'm glad Dr. Bagai mentioned long COVID. See, many people seem to think that this is just a common cold, but that's because that's the way they see it. See, what I can only report what I experienced, right? So for most people, for them, it's like a bout of fever, a couple of days of body pain, and then they're back to normal. Now, COVID is not a common cold virus. It can affect multiple organs in our body, including our blood vessels. And that's really the reason why many people suffered heart attacks and death and strokes in the early days, because we really had no defense. There was no antiviral, there was no vaccine in the beginning. No one had encountered this virus before. That's why it caused so much death. But we are sitting now in 2025, we are far away from that. So I would reiterate Dr. Bagai's statement that stay away from this infection, because you have a 5% chance, that 1 in 20, of picking up a long-term health condition, which I've heard people relate to me as loss of memory, slowness, intellectual slowness, affecting their work, and also severe body tiredness and being short of breath with even trivial exertion that does not really have a medical cure. So it's always better to avoid COVID, especially during times of surge. Pays to be extra careful.
I just want to actually reiterate what you've said for our viewers, and please correct me if I'm wrong. You have said that even though this particular strain is something we don't need to panic about, we don't need to be extremely worried, because like a viral, it will, unless you have some, chronic conditions, likely to go away in 4 or 5 days. But it's better to avoid it because it could give you long COVID, which doesn't have a medical cure. Is that what you said?
True. There is no medical cure for long COVID. And there are a lot of fake assurances and fake treatments available on social media, particularly in Western nations. There are clinics that claim to cure these patients, which is a scam for the most part. There is no scientifically proven medication that gets rid of long COVID. So the World Health Organization themselves have taken cognizance of this fact, and they've said that the only way to prevent long COVID is to not get COVID. It's a very direct and plain statement.
Dr. Sanjeev, that is so interesting. So if I can ask you, is the medical community happy with the surveillance and tracking of COVID cases in India as of today? I know a lot of people are not even getting tested because, like you said, it's like a viral, they sort of get better. But to Dr. Rajeev's point of long COVID, is there a way to determine that, or that's just something that once you get COVID, in the long run, you realize that you have long COVID?
Yeah, so long COVID is something which we call as PACS, that's post-acute syndrome, COVID syndrome, PACS. That's defined as anything which comes up approximately 3 months after the acute episode. These symptoms can come up even 3 months later, 5 months later, 6 months later, even a year later. So patients who had COVID in 2019, 20, 21 sometimes are even presenting now. And there are lots of meta-analysis of multicentric trials which have documented this, that long COVID ranges between 10 to 15, some studies even up to 20% of patients. Even mild attacks which don't require hospitalizations are predisposed to long COVID. So classically, what we see in long COVID is cognitive issues. So memory, attentiveness, depression, concentration, attention, especially in children. And talking of children, very often in the initial phase, there was a lot of debate. Children have natural immunity and they're not going to get COVID. They don't get long COVID. Absolutely, they get COVID. Even newborns have got COVID, and long term, they get long COVID. So especially for children, from the schooling point of view, it affects. extreme fatigue, muscle pain, what we call as myalgic syndromes, that's very common, cardiac illnesses, hypertension, cardiomyopathy, heart attacks even years later, pulmonary disorders, pulmonary embolism, deep vein thrombosis, because it's ultimately called as an endovascular event. It involves the vessels, the lining of your vessels, be it arteries and veins. So you get thromboembolic episodes. You can get kidney issues, liver issues, bone issues, and so on. So this is not a good thing to get. The best way to prevent COVID is not to get it. Best way to prevent long COVID is not to get it. But there is, like Rajeev has said, there is no established medical treatment for long COVID. There are lots of studies which are still ongoing. There are lots of medications being proposed, but there is nothing which is as a peer-reviewed study to show that this is the line of treatment. Uh, Long COVID can even present uh, in manners which actually defy logic. So you can have skin rashes, you can have eye involvement, you can have tinnitus and hearing loss even 6 months, 8 months later. And very often we don't correlate it to a very mild cold cough fever we had a year back. So I think we need to be cautious, we need to be careful. I think public awareness in India is very important. And our ongoing effort with all platforms, be it social media, print media, electronic media, of course, our medical platforms, we must continue to talk of it and continue to give the message. Uh, we know that this immune memory, what we build, either because of vaccine or because of natural infections, decreases over a period of time. Even though this strain is mild, you can still get it, especially in the vulnerable group. So I think we need to continue to give this messaging. What I foresee, let's say maybe a year or 2 years later, we probably will have a more universal, and there is work already on it, a universal SARS-CoV-2 or COVID jab, very much like the influenza vaccine, which is given annually. So that work is still ongoing at the present moment. It's not been recommended as yet because it's not in the market as yet. But maybe in a year or two, we may have a universal COVID vaccine which will prevent these infections. Having said that, vaccines are never 100% protective. Vaccines only prevent severe infections and death. You may still get a breakthrough infection. That does not say the vaccine is not good. Vaccines prevent largely, when you talk in terms of efficacy, it is gauged in preventing symptomatic infections, asymptomatic infections, hospitalizations, and death. There are four basic criteria in which we evaluate the usefulness of vaccines. So I think vaccines will come in terms of a universal vaccine, but we'll have to wait a bit for it.
Right. Thank you so much, Dr. Rajeev, Dr. Sanjeev, for joining me for this today. I think, like you said, it's really important to spread awareness, to tell everyone that there isn't any cause for panic, but let's be careful, let's avoid getting COVID altogether. Thank you so much, everyone, for joining us today, and we'll be back next week with Your Health Decoded.